This presentation is on justice involvement in mental health treatment among veterans for the iReach program. A quick acknowledgement and disclaimer. iReach Rural Veterans is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The contents of this presentation are those of the author and do not necessarily represent the official views of, nor are an endorsement by, HRSA, HHS, or the U.S. government. The purpose of this presentation is to discuss the prevalence of justice involvement among veterans. And therefore, at the end of this presentation, you should have an understanding of the risk factors for justice involvement, barriers to treatment faced by justice-involved veterans, and the compounding issues for rural veterans with justice involvement. When looking at justice-involved veterans by the numbers, recent studies have shown that approximately 1 out of 3 veterans report a history of arrest, and this is compared to 1/5 of the non-veteran population, indicating a higher incidence of arrest among veterans. Military members are also more prone to lifetime arrests and substance misuse than their counterparts, and this is particularly true with driving under the influence arrests. Veterans comprise approximately 10% of the nation's total inmate population, and Vietnam-era veterans are substantially more likely to be involved in the criminal justice system compared to their civilian counterparts. Notably, in 2012, justice-involved veterans in the VA's Veterans Justice Programs reported 8 lifetime arrests on average. When looking at justice involvement among veterans with substance abuse and mental health problems, we see that male patients in VA addiction treatment programs who served before September 11, 2001, 85% had at least one lifetime criminal charge, 58% had at least 3 such charges, 46% had at least 1 lifetime conviction, and 17% had at least 3 convictions. Moreover, when we look at veterans in addiction or mental health treatment with any lifetime history of military or non-military trauma exposure, 46% reported a history of having a violent or non-violent legal charge. And these numbers really demonstrate the prevalence of justice involvement among veterans generally and among veterans with substance abuse and mental health issues. It's important to understand what risk factors contribute to justice involvement among this population. So according to ORIC in 2023, there are 3 levels of risk factors for justice involvement among veterans. There's individual level risk factors, and these are those experiences that veterans faced before enlistment or before their military service. There are service-related risk factors. Those are the experiences that happened during or related to military service, and post-service risk factors, and those are the experiences that came after military service. So when looking at these risk factors, it's important to take into consideration how each level of risk factor influences justice involvement. At the individual level, adverse childhood experiences and other childhood factors such as educational experiences, family dynamics, household structure, poverty, and education level are all generally correlated with justice involvement in the community. However, these factors may be especially salient among the veteran population. For service-related risk factors, these are things such as post-traumatic stress disorder, traumatic brain injuries, and military trauma, including sexual assault. All of these factors are also correlated with justice involvement. And finally, post-service risk factors, those that come after separation from the military, include a loss of military support systems, the need to establish new social relations, and the adaptation to civilian norms and expectations that may cause readjustment difficulties and strains in relationships. Here, it was important to highlight the service-related risk factors and justice involvement among veterans. While there's a lot of research on the relationship between childhood factors and criminal activity, there isn't quite as much for service-related risk factors among veterans. And so the research that has been conducted has found that criminal justice involvement is higher among those with PTSD, uh, traumatic brain injuries, trauma, and other issues related to time in service. So the odds of criminal justice involvement are 61% greater for veterans with PTSD than for those without. The odds of arrest for violent offenses is 59% greater for veterans with PTSD than those without. Criminal justice involvement is 59% higher for those with a TBI than those without. And among justice involved veterans, those with military sexual trauma are overrepresented. So men were 200% more likely to report a history of military sexual trauma, and women were 82% more likely to report a history of military sexual trauma. These statistics really highlight how impactful service-related risk factors are on justice involvement, and these factors need to be taken into consideration when practitioners and the justice system are processing and dealing with veterans who are justice involved. And so among justice involved veterans, there are a number of barriers. And here the highlight is on the stigma and stereotypes around mental health care utilization. Klein and colleagues found that beliefs about and barriers to mental health care reduced odds of mental health care utilization by nearly 50%. And some of these beliefs included things like it would harm my reputation, mental health care doesn't work, or I don't know where to get help. And these stereotypes and beliefs are especially harmful because they prevent veterans from getting treatment when they should. And research has shown that treatment is associated with a reduction in criminal activity. However, 1/3 of veterans with mental or substance abuse disorders do not receive treatment. All of these issues are compounded by rural locality among veterans. Access to treatment is significantly more difficult in rural areas. There are fewer resources, increased homelessness, fewer educational and employment opportunities, and little social support. And all of these factors come together to create a lot of barriers to treatment and a lot of difficulties for veterans to get the help that they need, not only for their mental health, but also to prevent justice involvement. So in conclusion, justice involvement is highly prevalent among veterans. There are many factors at the individual level, the service level, and the post-service level that contribute to justice involvement. Beliefs about mental health care serve as a barrier to receiving health, and rural locality complicates treatment of veteran issues. Thank you for taking the time to watch this presentation. Please feel free to check out all of the other resources compiled by the iReach program related to various aspects of veteran health.